Hello, everyone. Welcome to today's Research America Alliance discussion. I'm Jenny LeRae, and I'd like to thank you for joining us on Zoom and for your partnership in the Research America Alliance. If your organization's not a member, I encourage you to reach out to Kristen Furlong, who's our Director of Membership and Development, and her email is in the chat. Today, we are joined by Dr. Jennifer Nuzzo, an epidemiologist and the director, of the Pandemic Center at Brown University School of Public Health. Jen is a real thought leader on pandemic preparedness. She's going to discuss the latest on H5N1, what it means for those in the trenches in the research and public health community, what it means for the public, and what we should be doing now. So as always, please type your questions in the Q&A box or chat, and we'll get to them during the audience Q&A portion of today's session. So thank you so much for joining us, Jen.
Thank you, Jenny, and thanks to Research America for hosting this, and it's a pleasure to join you.
Well, can you remind us of the history of H5N1 as a threat to humans? I mean, we've seen this movie before, correct?
Yeah, I mean, it does. And I think the movie is called Groundhog Day because this is that, so close to the heels of COVID-19, we're talking about yet another pandemic threat, I think for many people feels quite disorienting. And in particular, talking about this pathogen, I think is what is quite upsetting. This is not a new pathogen by any means. H5N1 was first identified in the late 90s, and there were early outbreaks in the early aughts that really got the world's attention. And in fact, seeing more and more human cases associated with this virus that is still to this day largely a bird virus. But in the early aughts, seeing it jump to humans every so often really was quite alarming, in part because when it would find its way into humans, it would be quite a deadly virus. In fact, in totality, in watching this virus over the span of more than 20 years, about half of the known cases, people who are known to have been infected with this virus have died. And that's quite stunning. I mean, we don't, would make this virus much more deadly than something like COVID-19. And so we've seen this virus happening. In fact, there was a lot of concerns in the early aughts about the human cases that were occurring and the speed with which we were seeing human cases occurring. And it really was one of the things that helped prompt an attention on pandemic preparedness and the recognition that countries can and should prepare for future pandemics, that actually pandemics aren't entirely unprecedented occurrences. In fact, in the last 100 years or so, there's been about 3 or 4 pandemics. And so this is something that does happen quite considerably. So H5N1 was on the pandemic watch list for quite some time. And I think just global attention shifted in part because we did have a pandemic in 2009, and it was an influenza virus, but it wasn't H5N1, it was an H1N1. And then other viruses, I think, just kind of displaced our attention, kind of distracted us from watching H5N1. But in the last 2 years, I would say, attention has shifted back on it, in part because not only is this virus reminding us that it's still here, but it has really expanded in terms of its global spread. We're seeing it in places that we just didn't see it before. And it's really expanded in terms of the numbers of species of animals that it's infecting, including mammals. So mammalian animals, not just humans. And when you start seeing what's predominantly a bird virus start to show up in mammals, that raises concerns that this virus, which doesn't yet have the capability of spreading easily between humans, that it could gain the ability to spread easily between humans. And so that's why you're hearing so much attention on it. In addition, we're now having a situation where humans who are exposed to infected animals are getting directly sick from those animals. And that is quite a worrisome situation, in part because we've known this virus to be quite a deadly one. Fortunately, the recent human cases haven't been deadly, but we don't have any reason to, not worry that they couldn't be deadly.
Wow. Well, thank you for giving us that background and that history. You wrote an op-ed in the New York Times recently called "How Scared Should We Be of bird flu. And for those who didn't have a chance to read it, um, talk to us about how concerned we should be and what should we be doing now? And when I say we, I think that includes both advocates, but also, government agencies. Um, what should we be focused on right now?
Yeah, so I mean, I think that the term scared is not a helpful one. I think fear-based narratives in public health are very fraught and not really productive. But the kind of premise of the piece really came about from the fact that you were hearing a lot of experts, including myself, express worry about this virus, and that a public that was listening to experts, perhaps they discovered them during COVID and started following them for advice, was hearing that worried and perhaps internalizing that it meant they personally were at risk. The reality is experts at this point are quite worried about this virus. We are worried about, top of mind, worried about the workers, the agricultural workers who are being exposed to the virus in the course of doing their jobs because the animals that they have contact with are getting infected. So that is the top worry. And experts are expressing worry about this virus in part to try to protect those workers. We are also worried that the virus could gain the ability to infect people more broadly, to spill into other communities beyond just the agricultural sector and infect people. That hasn't happened yet. We have no idea if it's going to happen, but we are worried that it could and are wanting what is predominantly government agencies are the ones responsible to take action to prevent that from happening, as well as to take action to protect the farm workers that we know are being exposed to this virus today. So that was the whole premise of the piece. It was also meant to kind of, explain why we can talk about these things in the public square and recognizing that's an important tool to getting government agencies to find the will to act. But that doesn't necessarily mean we are telling someone who's sitting at home with no known connection to infected animals that they are personally at risk at the moment.
Don't you love when you write something and then the editor slaps on a sensationalistic headline?
Well, I have to, in this case, really give the editors credit because in that piece, there was a flow chart that I will tell you when I was first asked about it, I thought it seemed incredibly obvious, but people have been expressed a lot of gratitude for the flow chart in particular. So it was an important lesson for me that things that might seem obvious to those of us who kind of see the world through epidemiological glasses, it may not be that obvious for everybody else. So I was grateful to the editors for thinking that would be a helpful tool because it turned out people seem to appreciate that.
Well, we put the article in the chat. What are some of the barriers to assisting farm workers?
Yeah, so I think the biggest one right now is that this is a situation that is really falling through the cracks of sort of the U.S. Uh, biological health, public health system, in the sense that the infections that are occurring in animals, and then humans who have contact with these animals are at risk of being infected. But you have different government agencies worrying about the animals than who are worrying about the humans. And there isn't really a great forcing function to take sort of an integrated approach so that we can worry about both and worry about both by using a strategy aimed at both. When this virus finds its way into birds, including poultry and domesticated birds that we raise agriculturally, it tends to kill them. And so there's usually a fairly swift response from the ag sector to make sure other flocks are not infected because there's big economic losses with that. There's also financial incentives to find infections in bird flocks and respond quickly, which involves culling the birds. Conversely, when the virus finds its way into cows, which is what one of the things that we're seeing now, it doesn't tend to kill the cows. It actually could make them quite sick and it could decrease their milk production, but it doesn't kill them. And so the responsiveness of the agricultural sector to infections in cows has been quite different and in my view, quite sluggish. But there isn't yet an integrated, kind of effort to say, how do we protect these farm workers? we know the ag industry is, of course, worried about the economic losses. They're worried about the reputational risk to the products that they produce. And that unfortunately is taking form in, I think not quite an integrated and forward-leaning response. I don't in any way think that farmers don't care about their workers, but I don't think they've been given enough tools to help protect their workers while also continuing to produce milk and other products that are, under some kind of market stress as of late. So there are some real challenges there. And in my view, like it's kind of reveals the limits of the US bureaucracies.
Hmm. You mentioned milk products, and there's already, I mean, there probably was from day one, but lots of misinformation regarding H5N1, about, the milk supply and keeping our cats safe and lots of things. What have you seen? And is that also a concern? The mis and disinformation that's spreading.
Yeah, I mean, there's a lot. There's a lot. I would call them there's at a high level, there's a lot of misconceptions. And I think the one that I'm most worried about is perhaps a belief that I'm hearing within the ag world that this virus is just going to kind of rip through farms and be gone. And I have no scientific evidence to say that that's even remotely true. Influenza viruses don't typically go away. In fact, they just kind of continue to mutate and change and find their way back to us. And so I think, some of the sluggishness I've heard on the ag side is the thought that, this virus will be over in weeks, and the weeks become months, and it hasn't exactly happened. So that's just one kind of misconception. This virus is not going away. The other one I think surrounds like who is really at risk. And there are some people who are deeply worried about the safety of milk. I am not one. So long as that milk is pasteurized, I feel comfortable having my kids drink pasteurized cow milk. I do worry about raw milk consumption, but I've always worried about raw milk consumption. There's a whole lot of evidence about the risks posed by raw milk, and there's been lots of outbreaks tied to raw milk. And so, given the amount of virus that they have been able to find in raw milk and the number of samples taken from the kind of just looking across the country at milk supplies, I would really be worried about consuming milk that wasn't pasteurized. Now, I'm going to say we don't have any known case of a human getting sick from drinking raw milk or any kind of milk. But cats on the farms where they've had outbreaks did get very sick, get infected with the virus and die. And the thought is that it was possibly due to the cats having consumed raw milk. Will that happen to humans? Don't know. But in my view, given all we know about raw milk, there is a lot of reason to be worried about the safety of consuming raw milk.
Well, as you've noted, there are strong recommendations against consuming raw milk anyway.
Yeah.
But people do, and so it's important to get that information out there. Let's talk about the H5N1 vaccine. My understanding is that there was work developing a vaccine, and there may actually be one. We don't know, perhaps we don't know if it will respond to this virus, but what can you tell us about the vaccine process? What are some barriers to ramping up the production of it? So let's start there with the vaccine.
Yeah. So, the storyline about vaccines has changed a little bit. When we first started kind of getting recently re-worried about H5N1 because of the kind of global spread of it, and then certainly seeing it in cows for the first time in the US, and then seeing farm worker infections, there was a little bit of kind of assurances coming out of some government agents saying like, don't worry, this isn't COVID. And, at the start of COVID, we didn't have any vaccine at all. We've been tracking H5N1. We have tools to address it. We're better off. And that's sort of true, but also that's a bit of a, I think, oversimplification, and it's overly rosy. There are in existence vaccine doses that are thought to be protective against the virus that's currently circulating. It's not enough for the country, but the question is, what, if anything, should we be doing with that today? When I talk about vaccine today, that what I am most interested in is making sure that the people who we know are being exposed to this virus today, the farm workers, have access to this vaccine so that they can be protected from the worst case scenario that this virus can pose. Again, the cases that we've seen in farm workers have been mild, fortunately, but we have a lot of data on this virus that suggests that it's not always mild. In fact, it's often not. And so, in my view, I think we should be using the vaccines that we have available today for the goal of protecting farm workers to prevent severe illness in farm workers. That is not the same as we should be vaccinating America. I do not think that is warranted right now. And in part because this virus is not spreading easily between people. If it gained that ability, then we would be in a new pandemic. And then people would be talking about making enough vaccine for a pandemic vaccination scenario. But the virus would have to change in order to gain those abilities. And so we don't know if that change would make it different from the amount of vaccines, the types of vaccines that we have now. So sometimes all of that gets conflated. And so you'll hear people talk about vaccines, and in some cases they're talking about, should we vaccinate America today? I would say hard no for that. Should we vaccinate farm workers? I think the data are compelling enough that it's worth protecting them with vaccine. Bottom line, though, is that were a pandemic to start today, regardless of how good a match it is likely that we would not have enough doses for most of America for some time. And how long it will take, I think, is subject to much debate. And I think there's been shifting explanations for how much we currently have on hand and how much we'll be able to get. If the virus were capable of causing a pandemic, it wouldn't just be the United States that's looking for vaccines. It would be all of the world. And what we saw in the last influenza pandemic that happened in 2009, sometimes countries got further ahead in line for vaccines than others. And so the US had contracts with a company that it was expecting to get doses from, but the country in which that company was located said, you need to fill our orders first. So I think there's some geopolitics that will also play out there. And so I would say, overly rosy projections of what will be available when may not hold up in real life.
Would vaccinating the farm workers, offering vaccinations to them, would that help to forestall transmission to other humans?
So we don't know, and possibly not. It would be my guess. Part of it is that we don't know how much the vaccines would be able to block transmission. I will say that the data on flu vaccines preventing transmission, I think, is limited, if not weak. That's not really what I'm worried about. I'm mostly worried about protecting farm workers so that they don't get severely ill. And in particular, the most recent cases were in farm workers that were sent in to cull infected birds. And it was, it's summer, it's really hot throughout most of America. We've had, really tremendous heat waves at various points this summer. And workers were sent in to cull an infected flock and did not wear personal protective equipment, in part because it's really hard to do when it's really hot under the circumstances in which the current culling occurs. In my view, first of all, you don't send workers in to cull in a known H5 infected flock without personal protective equipment. And if it's too hot to wear the personal protective equipment, you don't do that. But given the fact that this is happening, this is why I think it's important to offer vaccines so that people have another form of protection against severe illness.
OSHA, the Occupational Safety and Health Administration, are they involved in regulating the working conditions of farm workers, or is this really an ag department jurisdiction?
So I don't know the answer to that fully. I was raised on a call that I was on about OSHA's involvement, and I've heard conflicting answers. So rather than give me the wrong information, I'll just say, from what I know, is that there is not enough regulation of the conditions in which these farm workers work. I don't
Right.
know who to point the finger at, but I
Hmm.
will say as an epidemiologist, if we are sending human beings in to an environment where we know there is H5N1 and we are not giving them adequate protection to do so, that is, just that's unacceptable. Unacceptable.
Absolutely. Um, let's see. I know we're starting to get a lot of questions. I'm going to turn to a couple of pre-submitted questions we received. What is the state of predictive metrics to assess preparedness and response capabilities for H5N1 or other health security threats? We heard a lot about uh, predictive metrics during COVID-19.
Yeah, so I'm going to answer this question wearing another hat of mine, which is I lead a project called co-lead with other organizations, a project called the Global Health Security Index. And what we try to do with the index is we try to measure 195 countries' capacities to get ready for and potentially respond to a pandemic scenario and other, significant infectious disease emergencies. What we measure is what countries have, to a little bit what they can do, but mostly what they have, because it's very actually hard to measure what countries can do. And what we have found, probably a bit counterintuitively, based on maybe headlines that people had heard, is that countries that were better prepared tended to do better during COVID-19. It's hard to measure in real time because often when you're looking at countries and see how they're doing in an emergency, the same tools that you're measuring for to say are they prepared or not, or to what extent are they prepared, are the same tools that they would use to do things like count cases and determine cause of death, enumerate deaths associated with a particular virus, right? Things like tests and, the extent to which they have epidemiologists who can work up the data and data reporting systems, et cetera. Those are all the things we sort of measure as a mark of preparedness. But we've generally found that for the most part, and there are definite exceptions, that better prepared countries did better. An exception is the United States. And this is where it kind of gets into what the challenges are with doing this kind of work, which is that before an event, you measure what countries have and maybe to some extent what they can do. But it's very hard before an event to measure what they will do or what they do do.
Mm.
If the best analogy I can give is that if you want to measure, if like a city, how fire ready they are, you might go around and say like, what percentage of their buildings have fire alarms? But you may not know if you know, if they dismantled the fire alarms or if they never replaced the batteries, or worse, the leader
Mm.
of the city says, ignore those fire alarms. There's no fire. The fire is a hoax. uh, don't worry, go about your business. So that's really hard. So I'm saying all that because the question said predictive, and predictive implies that you can say, because you have this, you will do better. And what's missing from that equation is what you actually do in an emergency. I think it would be nice if we could do a better job of trying to predict. The challenge will be predict what. And in each scenario, the types of things you use, there's a lot of commonalities, but sometimes it's different. If we had tried to figure out which countries would have been better at handling an Ebola virus in an epidemic scenario, that is much different than trying to figure out which countries would do well handling a pandemic scenario. So anyway, there are some challenges there, and I think it's a field that's absolutely, we need to evolve and develop and progress.
It's complex, and what's on paper, right? Scenario planning, it doesn't
Yeah, and
always translate into viable action.
it's really challenging when you have ultimately public health data that are measured globally using very, very different methods, and then you have a lot of people try to analyze those numbers using statistics, not recognizing what goes into making those numbers in the first place. So it's really complex. And I think this is one of our big limitations, is that our public health data aren't standardized. They're the result of many, many different processes. And I used to say, comparing COVID cases between countries is not just like comparing apples to oranges. It's like apples to tractors, because you may have a country that is very aggressive about going out and doing testing and trying to enumerate as many infections as possible. And then you'll have another country that's only testing travelers. And those countries' COVID numbers only represent the people who showed up at the border and paid for a test. And then, if they were positive, they weren't admitted. And if they were negative, they were allowed. So it's very,
Yeah.
very difficult.
So let's come back to the US for a bit, because I know that you convened public health and national security experts to learn from COVID-19. And if you could share, what are some of the essential lessons that came out of this group and that, we need to put into action?
There are a lot of lessons, really a lot of lessons. I will say the biggest one for me is one that I see sort of playing out now, which is that, and I don't think this is unique to the United States, but I'm seeing it quite considerably now, which is that as a field in public health, we tend to be a very retrospective field, meaning we look at what's happened before, and then we sort of assume that that's what's going to happen in the future. And to some extent, you have to do that because you want to be evidence-based. And so you have to be informed by what hasn't happened in the past. But I think we have to have an honest look at the strength of the data that we have and are basing decisions on, and recognize that they may not tell the full story. And sometimes, and this is, I think, where the national security field is a bit different, they are much more used to kind of engaging in scenario-based efforts where they think, based on what I'm seeing now, what is the realm of possibilities of what could happen? What is the worst case scenario? And what do I need to do today to prevent that from happening? And that's where I see, some real challenges whereby, well, we've had now, about 13 H5N1 cases in the US in the last year. They've been mild. Do we assume that all future cases will be mild? Or do we worry that they might not be and take action to prevent that from happening? So I would say that's the number one lesson. The second big lesson is that our social vulnerabilities are our pandemic vulnerabilities. And when we pursue strategies that only work for some and often only work for the most privileged, we're just not going to have the kind of impact that we want to have. We have to start with where the vulnerabilities are and make sure that we have resources and plans that are adapted to those communities. We pursued a number of strategies in COVID-19 that I don't think had as much impact as we would have hoped they would have, and in part because we kind of ignored where the greatest risks were. And so I really do think, in the preparedness field, for a long time, you'd make a plan for a pandemic that was sort of an average plan for the average case. And then, maybe there'd be a chapter on like vulnerable populations or risk factors that you would have to be worried about. But that's wrong. Like, we need to flip that. We need to start thinking first about the vulnerabilities and what our strategies are, and then, expand from there. So,
well, the case of the farm workers right now is a great example, right, of a very vulnerable population that
exactly.
that were, very challenged in terms of reaching. So we have a lot of advocates on the call, and what would you encourage advocates to be doing right now, vis-a-vis policymakers, to be better prepared for H5N1? And then I'm just going to tell the audience that we're going to switch to audience questions after this. Please, if you have one, put it in the chat or the Q&A. So what should advocates be focused on right now?
So I think this is where, I still think that there's a fact-finding mission that's needed here, which is that there's a lot of information that we don't have about what's going on with H5N1. I want to give credit to the kind of intrepid health departments that have chosen to be a bit more aggressive in trying to figure out where infections may be occurring and monitoring farm workers who were likely exposed to on a farm that's been known to be infected. Not all states, I think, are as aggressive in how they are handling this virus, and I really want to give credit to the ones that are. That said, there's still a dearth of information. I was kind of ranting on Twitter this morning about my frustration that when we announce these cases, we don't tell when they were infected.
Mm.
We don't tell when they were tested relative to when we think they were sick. And anyway, that's just one piece of probably very nerdy information that I really wish. But it's a glaring anomaly in how outbreaks are typically investigated and reported. If you look at how countries report their H5N1 cases, there's a fair amount of details. The patient was, first reported to a hospital on this date, and they were tested on this date, and the U.S. just isn't sharing that kind of information. That's really important for me to know and for others in the public health field to know, because it helps us gauge like how fast is this thing moving, and these cases, are these cases from months ago? Is it possible that the reason why a whole bunch of symptomatic workers tested negative despite a known exposure and similar symptoms was because they were tested many, many weeks after possible infection? Anyway, so there's a lot of me. So I do think advocacy groups can be helpful in trying to kind of increase some of the transparency here. Now, this isn't meant to be punitive. I understand that this is a very sensitive issue. I understand that farmers, particularly dairy farmers, who are kind of left to battle this virus with not a whole lot of resources and not the same incentives that the poultry industry has. Um, they're worried about their businesses, and the goal here is not to put anybody out of business or in any way harm their business. The goal here is to make sure they have the tools they need to continue to produce the products that we all depend on, but also be able to do so safely for themselves, their families, their workers, et cetera. And I think that there's a case where the absence of information is actually hurting all of the goals, in so much as it creates a sense of lack of trust rather than trust. I think transparency really would be beneficial to agricultural interests as well as health interests. So I'd really encourage advocacy groups to try to, tell us what's going on. The other thing is that I think we're making a lot of assumptions on how best to manage this situation, knowing that the farm worker community is diverse and includes a lot of different job titles, includes lots of different types of folks, and that some folks may be harder to reach than others, which I don't doubt that's true. But I think we're possibly over-interpreting how hard it is. And this is where I think community-based organizations and advocacy groups can be really helpful in trying to say, listen, these are what the farm workers want. These are what they're asking for. On the H5N, I'll give you a very practical example. On the H5N1 vaccine front, I've been advocating for using vaccines, offering them, not mandating them, offering them to farm workers who may see if they wish to have protection. There hasn't been an assumption that farm workers won't want the vaccines, which may be true, but I'm not convinced that's based on actual hard facts. If it is, it is, and we should know that. But I don't think making assumptions based on extrapolations from other events and other populations really helps us. So I really think that's where people on the ground who may have a closer to connection to the patients that we're talking about can help shine a light on what the best path forward is.
That's a great lesson from COVID-19 as well, right? Particularly around vaccination, to really work at a very, community-based level.
Yeah, I think that is a really key lesson, which is that it really is all about communities and communities' willingness, communities' input, not just, as a value setting process, but also to make sure plans are operationally relevant and feasible. And that's where, kind of non-governmental entities, I think, have a really important role to play.
What a great discussion. I'm so glad you're with us, Jen. I'm going to ask Jacqueline Lagoy to join us on the screen. And I know we've gotten some really great questions from our audience.
Yes, thank you, Jenny, and thanks, Dr. Nuzzo. It's been great. Thanks for lending your expertise to the discussion. So I'll start with the first question. We were talking about global health earlier. So 2 days ago, WHO published an article about ramping up H5N1 mRNA vaccine for low and middle income countries. Will you discuss the vaccine efforts in the US and globally, and what do you recommend?
I'm gonna answer this on unsatisfyingly high level, in part because this is one of those recurring lessons. We saw it in H1N1 in 2009. We saw it in COVID, and I think we're going to see it play out again, which is that the sum total of existing vaccine manufacturing is insufficient for a pandemic scenario in which every country needs vaccines all at the same time. So we need new strategies for making vaccines that meet global demand. We have learned now twice in two pandemics, COVID and 2009, that countries sharing vaccines is just not a strategy that works. It just doesn't work. Countries first take care of themselves, and then they may think about sharing. And often by the time they get to that point, it's just too late. So we need a new strategy. That said, I'm heartened that there's lots of new discussions and new efforts on the table to try to pursue those strategies. It's tough though, because in some ways you have to maybe bet. And whether an mRNA vaccine is the right approach for H5N1, we just don't know yet. People are hopeful, but we just don't know yet. But we also know that not only do you kind of have to pick, you also have to make sure that when you're making stuff regularly and not just kind of turning on the lights and dusting off the cobwebs of a facility when a pandemic hits, because this is not easy work by any means. And so what are the scenarios that allow the regular production of vaccines that then can be turned over to H5N1? I think there's still some questions there, and some of the questions are about the staff and who runs these places and the training, et cetera. So there's a lot of work to be done is what the bottom line is. I am very heartened though that this is now a global conversation that's happening, that more work is going into this, and I'm very hopeful for those things. I will also just kind of insert an answer to the question that wasn't yet asked, in part that as challenging as the technical issues are, what happens after we have a vaccine is as challenging and possibly more important than the technical challenges. And I say that reflecting on the fact that during COVID-19, more people died after the development of multiple safe and effective vaccines. It's not just a question of, are there enough vaccines? Even in settings where there were ample vaccines, and it's not just the United States, there's many other places, people died because they didn't believe that the vaccine was in their best interest. So we need to spend as much time thinking about how we get vaccines to people and how we stimulate demand for them as we do thinking about the technical aspects of how we get the antigen into vials and get it to communities.
Right, really
Excellent
good
point.
point.
Yeah.
Thank you. So on to our next question. We were talking about the farm workers and their industry, that they are among the most vulnerable in our country. So what level of concern do you, Dr. Nuzzo, do you have about the likely discrepancy between what gets reported through formal channels and what may be happening on the ground at these farms?
I'm really concerned. I mean, there's a lot of confusion about what's happening. I think there's also a lot of reliance on very limited data. For instance, a lot of the effort to go out and assess farm workers and their vulnerabilities is tied to first finding the infections on farms and cattle. And we know that testing piece is really, really limited. And so if that's the first thing that's going to trigger an investigation, we already know that we are likely going to be missing exposures that are happening. And so I'm worried about that. I'm also worried about what happens after an infection is found on a farm and how we follow up with the farm workers. And a lot of these efforts are sort of centered around their place of employment, which may not be work for all people. And that's why, one of the other things I've really pushed for is to make sure that we have adequate treatment and testing available outside of people's places of employment. So making sure health clinics and healthcare providers that farm workers may be likely to go to know about this virus and have the tools to be able to test their patients and give them treatment if they test positive. And also just to kind of do educational efforts aimed around improving people's understanding of the virus and the importance of getting tested and treated.
Great. Yeah, very good points as well. On to the next question. It's a bit multi-part question. What advice do you have for people who try to engage groups that don't have immersion in science and health terminology? For example, let's say you're speaking with a county commissioner who is responsible for setting farm health standards, but they don't understand why the regular flu vaccine isn't enough for farmers in their county dealing with culling a H5N1 flu infected population. How can you effectively communicate that H5N1 flu is different than H1N1 and that some people may need a different form of protection?
Yeah, so let me tell you what not to do. And I think that there is an effort, there is sometimes an inclination when we're dealing with technical matters to strip out details. And maybe just to kind of summarize at too high a level. People are smart. They may not understand jargon, but if you get rid of the jargon and just explain what is happening using regular plain English words, people can follow an argument. What I think doesn't work that I see sometimes happen is that people are worried that it's highly technical and they're used to speaking a jargon and it's hard to translate that into plain English. And so what then comes across is a very kind of, bold statement because it's not padded with the rationale supporting that statement. That I think is what doesn't work. And so I think you can just say, listen, there are flu viruses that, circulate every year, and a seasonal flu vaccine is important to protect you against that. This one is a different virus. This is mostly affecting birds, but now we're seeing it's gotten in some other animals and it's starting to infect people, and it's deadlier than what we typically see for these flu viruses. We don't yet have, you can't go to your local pharmacy and get a vaccine for it, but there may be other tools available to help protect people against this different virus. And just be willing to answer people's questions. But I think the biggest mistake sometimes we make in public health is assume that people don't want to know the details. People do. They want to, they're smart, and extraordinary claims require extraordinary proof. So tell them the evidence that you're using to support your statements. Just take out the words, the jargon that people don't understand.
Great advice. I certainly always want to know the details. My healthcare providers. So I'll turn it back to
where
Jenny.
we do endless hours of research to figure out which toaster to buy on Amazon. Don't assume that people don't want facts and details. They do. They just sometimes need a little language translation so that they can follow along with you as you tell the story.
Well, you're a great example of just a terrific scientist communicator, really. We have one last question, which is, as we move into our annual flu season, will that have an impact on the H5N1 virus?
Yeah, so short answer is we don't know. I think virologists are a bit worried. And one of the scenarios that they're worried about is what happens when a human being is infected with two viruses. And that is one of the scenarios that's been gamed out that people think could allow H5N1 to gain new abilities because it can borrow things from a virus that is already well adapted to infecting humans and spreading between humans, which is what we see in our seasonal flu viruses. So that's one of the concerns, and that's likely one of the reasons why CDC just, I think it was yesterday, announced a plan to start trying to implement a farm worker seasonal influenza vaccination program. It won't be rolled out to October. It's only going to be in the states that are reporting outbreaks on farms. And we already know that the surveillance in cows is really, I think, woefully inadequate. So there's lots of holes. am supportive of this effort in part because I think it's important to develop infrastructure to offer vaccines. I kind of wish it would happen with H5N1. I wish it would happen faster, but nonetheless, starting the process. And also, I think it'll allow figuring out how to track vaccination of workers. And that word probably bothers people saying track because it sounds like a government thing. But mostly you want to know if someone got a vaccine, that they were okay after the vaccine, which we would expect. But we, for the sake of making sure we are monitoring the quality and safety of vaccines, do monitor vaccinations so that if there's any potential problem, we can spot it early. So that is important. But how much of an impact that will have on protecting, first of all, the seasonal vaccines will not protect workers against H5N1, and what it will do in terms of averting a pandemic, I don't think we really know. But I think it's a reasonable bet that it's could help to some extent. And so anyway, I think there's other benefits regardless.
Well, that's all we have time for today. I'm going to make a quick announcement, but I want to thank you, Dr. Jen Nuzzo. You
Thank you
have
so much.
shared just a superb level of information and insight to us today. So we thank you. We're very grateful that you took time to join us. For those with us on the call, if you are an Alliance member, we're having our third discussion on the NIH reform framework. So as you know, the proposal was released in June by House E&C Committee Chair Kathy McMorris Rogers. We'll use the hour to compare notes on the chair's request for feedback, which is due August 16th. So email Jacqueline, her email is in the chat for the registration link if you're an Alliance member. And thank you again for joining us today. We look forward to seeing you again soon.